The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person. Why? Because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There is no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. This episode originally aired on the Jolla Cosmetic Podcast, hosted by Monique Ramsey. Hear more from Dr. Kiersten Riedler on the Jolla Cosmetic Podcast. You can find that on Apple Podcasts or anywhere else you like to listen. Welcome, everyone, to the Jolla Cosmetic Podcast. I'm your hostess, Monique Ramsey, and today we are going to speak to a new physician here at Jolla Cosmetic. Her name is Dr. Kiersten Riedler. Welcome, Dr. Riedler.
Hi, thanks for having me.
So, what inspired you to join the team at Jolla Cosmetic?
Being from San Diego and having lived back here for several years, I have always regarded Jolla Cosmetic as the top plastic surgery practice in San Diego. And I was at a point where I was looking to focus exclusively on cosmetic surgery. And it just turned out that Jolla Cosmetic was looking for a surgeon focusing on facial plastic surgery, especially complex rhinoplasty and facelift. So it was kind of a perfect match.
Well, that's wonderful. So I'll ask you more about your educational path in a moment, but I want to start with your philosophy and as it pertains to facial aging. And what do you kind of look at?
Facial aging is a really complex process, and it affects every layer of the face, not just the skin, but also the fat, the muscle, and even the bone. And so what I counsel patients about is prevention is really key. So the main things we can do to prevent or slow aging are reducing our sun exposure, using sunscreen every day, not just when you're out in the sun, avoiding tobacco use, just leading a healthy lifestyle. But eventually we all succumb to time and gravity, regardless of what we do to prevent it. But luckily we have really effective treatments to reverse aging. Because aging is a multi-layered process that affects the skin quality, the loss and descent of fat, wrinkle formation, it's important to address all of those aspects, all of the layers of the face. We've actually learned a lot in facial plastic surgery over the past few decades about how important it is not just to remove excess skin, but also to reposition the volume, the subcutaneous fat, and replace the lost volume to restore a youthful look. Usually there isn't just one treatment that I'm going to recommend. It's going to be a multi-pronged approach with maybe neuromodulators like Botox to prevent wrinkle formation from muscle movement, and then also fillers to replace volume, fat transfer to replace volume, and then, of course, facelift and surgical techniques to reverse gravity.
You mentioned bone. I find that interesting. Tell me what you mean by that.
So they've actually done studies using CT scans of people's heads and faces over time and have shown that the jawbone actually gets smaller essentially over time, especially in people who don't have teeth. Dental loss causes accelerated aging for sure, but even something called the piriform aperture, which is the opening of the nasal cavity, that actually widens with aging. And so that leads to changes in the contours of your face. And also the orbital rims, the opening of your eye socket, essentially, that also widens because of bone loss as well. And so all of those cause deep structural changes that are going to affect our external appearance.
Interesting.
Yeah.
So that's sort of why maybe as people get older, their eyes almost appear sort of sunken in a little bit.
Yeah, it's because of loss of soft tissue, but also loss of bone. It's actually kind of depressing or disheartening looking at these CT scans over time and seeing how everything just kind of wastes away. But fortunately, it is what happens. So we just do our best to undo it.
Right, exactly. In terms of advantages to being a female facial plastic surgeon, what do you think your advantages are?
Well, I think it's a definite advantage because as a female, I think I can really relate to and understand my patients, their concerns, their aspirations. I as an aging female, have a lot of the same experiences and concerns as my patients. And so I understand firsthand what aging changes pop up, where, when, and what to do about them. Mm-hmm. And just having the female aesthetic eye, I think, is invaluable.
And what led you to this specialty of aesthetics?
So I've always been interested in aesthetics and started reading about makeup and skincare as a teenager. And so in retrospect, it almost seems like an obvious choice for me, but it really was a long path. When I finished training, I thought I wanted to keep doing the broader scope of practice, encompassing all of cosmetic and reconstructive facial plastic surgery and some head and neck surgery, and felt like it might be a waste of my training to have spent so many years becoming skilled in so many different types of surgeries. But I've always been somebody who really strives to do a smaller number of things to the absolute best of my ability, rather than doing a lot of different things just satisfactorily. And I've come to realize how all those years of operating on every part of the head and neck were really critical to building my skill set and my knowledge of face and neck anatomy. For example, training in head and neck surgery, we do a lot of cancer resections and basically take the face apart and reconstruct it. And so I've become intimately aware of all of the structures of the face and the neck, because even though now I'm thinking about what it looks like on the outside, I know what's beneath it and how that affects the external appearance. And that's also really important actually with nasal surgery, because the structure of the nose is very complex. And even the septum and the deeper internal nasal anatomy will affect the external appearance. Because I realized that aesthetics is really what I love, and it's really my major passion. And all of the training is really what makes me a good aesthetic surgeon.
So now, what procedures do you love to do and why?
Rhinoplasty, that's one of my favorites. It's really one of the most complex and I think artistic surgical procedures there is, because no two noses are the same. And the internal anatomy of the nose is really delicate and complex. And one thing I like about rhinoplasty surgery is that there are hundreds of different maneuvers we use to achieve certain types of changes. So there's a lot of creativity involved. And it's sort of like coming up with a recipe, like what combination of techniques or like ingredients am I going to use to achieve the desired result. I also love rhinoplasty because it requires a lot of attention to detail, and just a half a millimeter difference in suture placement or shaving cartilage will have a noticeable effect on the outcome, which I think that's why a lot of surgeons don't love rhinoplasty, because it's kind of high stakes. But I really like a challenge, and I'm very detail oriented. So I think it works well for me.
So what have you learned over the years from listening to patients?
Listening to patients is one of the most important parts of my job, because every patient has different concerns and goals, and that's what they're coming to me for, is to address those. And so I can't even come up with a treatment plan without first listening to the patient. So that's really step number one when any patient comes to see me, is getting to know them, getting to know their motivations for surgery, getting to know what bothers them and what they're hoping to achieve.
And what could a patient expect when they come to see you for the first time?
The first step, like I just mentioned, is really just getting to know them, taking stock of their concerns, what they hope to achieve. And then I systematically evaluate their unique facial anatomy, focusing on what bothers them, because everybody's anatomy is different. And it isn't just the amount of aging, but it's the underlying structure that needs to be considered and will determine what the best options are for them. So then once I do my own facial analysis, taking into account what bothers them, I educate the patient about all the different options that we can use to achieve their goals, so that they are the one who are making an informed decision with all the available information. And we basically work together as a team to come up with a plan that they're comfortable with and that they are confident will help achieve their goals.
So you mentioned San Diego.
Mhm.
Tell us about yourself, where you grew up.
So I was actually born across the street at Scripps La Jolla.
Hey, me too.
Oh, really? Oh my
Yes, I
gosh.
was. I mean, way before you, but yeah.
Yeah, that I guess my mom told me that they used to serve lobster in the
They
maternity.
did. Oh,
Yeah.
yes. On your last day,
Things have
before you went
changed.
home, you got to have a lobster dinner.
Yeah.
Yes.
So I was born there. My dad was a neurology resident at UCSD at the time. My mom was a music and math teacher. And we lived in University City till I was 10 and then moved to Carmel Valley, and my parents still live there. I graduated from La Jolla Country Day School, where my mom was a music teacher. And then I, left for training for college, med school, residency, fellowship, and then finally got to come back here for good a few years ago, and I never want to leave.
So you can't just skip over that whole educational path. I'm not going to let you skip over the whole educational path.
Yeah.
So tell us, what does that look like? Because not everybody realizes how much time. So how does it start? So you were La Jolla Country Day, you graduate and you go off to college. Tell us about.
Yeah. So I went to college at Harvard University, just outside of Boston, and majored in honors neurobiology and minored in romance languages and literatures, and had a really great time in college. It was hard. It was a lot of work, but it was also a lot of fun. I made a lot of lifelong friends, and it was a really great experience. And also being here my whole life and going to the East Coast, which was a really different experience, but I loved it. I love San Diego more, but it was a good experience. Then I came back to Southern California and went to medical school at USC, University of Southern California in Los Angeles. So that was 4 years of just general medical training. And then went on to do 5 years of residency in otolaryngology, head and neck surgery, also at USC. I was lucky to be able to stay there, which was a really great training program. Got so much experience. Thinking back on it, I don't know how I had the stamina to do all those work hours. I don't know if I could do it again now, but it was a really great experience. Learned a lot. And then went on to do facial plastic and reconstructive surgery fellowship, which was an additional year of subspecialty training. And that was with my fellowship director, Dr. Jonathan Sykes, who is a world-renowned facial plastic and reconstructive surgeon, professor emeritus at UC Davis, and a past president of the American Academy of Facial Plastic and Reconstructive Surgery. And during that year, it was all facial plastic surgery, and we split our time between Sacramento and Beverly Hills, where his two practices are located.
Oh, interesting. What would you say you want listeners to take away from listening to this podcast?
I hope listeners get to know me as a surgeon and as a person, and see how passionate I am about facial plastic surgery and helping my patients achieve their goals, and know that I'm just here for them.
That's nice. So tell us about when you're not being a physician, what do you like to do outside of the office?
Well, one of my favorite things to do is cooking and baking. There's actually a lot of parallels I've realized between cooking and surgery, because just like surgery, cooking starts with devising a plan, compiling the ingredients and instruments, and then using your instruments to transform the ingredients into a finished product. And one culinary concept, it's called mise en place. I don't know if you've heard of it, but it's something I always think about when I arrange my instruments at the beginning of each surgical case. I think, okay, I'm doing my mise en place. I'm just arranging everything just like you do in the kitchen with your ingredients and instruments. So there are a lot of parallels, but then cooking has added benefit that you get to eat at the end.
Now, I found out something cool, which is that you're bilingual.
Oh, yeah.
And so tell us about where you learned to speak Spanish and a little bit about the Spanish side of you.
Yeah. So I actually started learning Spanish in kindergarten at Spreckles Elementary, which is a bilingual magnet school in University City. So that was my first exposure. But then I continued to take Spanish all throughout elementary school and then high school. And it was always one of my favorite subjects. I continued studying it through college, and I got a minor in Romance languages and literatures at Harvard. And then as a medical student and resident at USC, the majority of my clinical training took place at LA County Hospital, where about 70% of my patients were Spanish speakers. And while I could read and write Spanish really well, I wasn't quite fluent in spoken Spanish, and especially medical Spanish. So knowing how much speaking Spanish fluently would help me communicate with my patients, I decided to spend the summer after my first year in med school living in Guatemala. And I divided my time between medical volunteering and one-on-one medical Spanish instruction. And I think living in a Spanish-speaking country was really key, because I actually started thinking and dreaming in Spanish. So at that point, I knew I was probably bilingual.
Yeah. And how long were you there?
I was there for 3 months.
Wow.
Yeah. And then I've kept it up because I've had so many Spanish speaking patients throughout the years. A lot of days in residency, I was spending more of the day speaking Spanish than English, actually.
Wow. So maybe we could do some episodes in Spanish.
Yeah, sure.
I think that'd be so helpful for people who are thinking about a surgery, and to be able to, we have a lot of parts of our website in Spanish. So why not? I think that'd be fun.
Definitely. That'd be fun.
So as you listeners are out there thinking, how do I learn more about Dr. Riedler? So you can find her on our website, which is ljcsc.com. And we have her bio up there, and we'll be putting all her before and afters on there as we go. You'll be able to, over time, see some of the reviews. And do you have an Instagram that you want people to follow?
Yeah, it's just Dr. Kiersten Riedler.
We'll stick that in the show notes so everybody can link over there. And so before we wrap it up, there's one question that we ask everybody who's on our podcast for the first time. Our brand promise is where dreams become real. So what is a dream of yours that became real?
Well, a dream of mine was to be a doctor to help people. And one thing I love about aesthetics is that even though it's not about curing cancer or some of the typical, maladies that we're dealing with, people, it's nice that my patients come here excited to see me, and that I'm really helping them kind of in a different way, but in a way that's really impactful to their sense of self-esteem, self-confidence, and something that affects them in their daily lives. So I just feel like that's so rewarding, and I couldn't be happier. I feel like I'm so lucky to have this opportunity to join La Jolla Cosmetic and kind of live out my dreams.
Nice. And you're doing it in your hometown.
And yes, definitely. That was one of my dreams, always to come back to San Diego.
Well, thank you so much. And it was really fun getting to know you this way, because you and I are meeting for the first time.
Yeah.
And so it's fun to be able to meet you and hear you and hear what your vision is for your patients and why you love being a surgeon. And so if any of you out there are interested in learning more about the things that Dr. Riedler does or want to schedule a consultation, all of our links in the show notes, all the contact info, everything is there that we talked about today. And so thank you again for coming.
Thank you so much for having me. Looking forward to seeing you more of you.
Yeah, likewise.
This episode originally aired on the La Jolla Cosmetic Podcast, hosted by Monique Ramsey. Hear more from Dr. Kiersten Riedler on the La Jolla Cosmetic Podcast. You can find that on Apple Podcasts or anywhere else you like to listen. If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor, or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.